What's good, folks? Kyle Moore here, Black on Purpose ambassador and resident economist. So one of the major things that happened in July was the passage of the Big Beautiful Bill that happened around July 4th. Just to talk a little bit more about some of the worst effects of this Republican-led budget bill passing, I really want to focus on the cuts to Medicaid and SNAP, just to really emphasize what's going to happen here. So first of all, the funding that is going to be taken away from Medicaid is going to likely lead to a ton of hospitals closing in rural areas. In many of these places, these are the only hospitals that are for miles around. So when the funding that would be going to Medicaid goes away, that's the funding that's keeping these places afloat. And that's what's getting many of these folks in these rural areas access to the only healthcare that they have. As a result of that, you're going to see these rural economies take a major hit. And of course, you're going to start to see folks not get access to the healthcare that they need to remain healthy and in many cases even remain alive. Similarly, again, when you're cutting SNAP, you are taking food directly from the mouths of children. More children will go hungry as a result of this bill. And it's something that we have a ton of control over as the federal government. Sort of the opposite situation happened in 2021 during the Biden administration when we saw extensions of programs like SNAP to cover more families for longer periods of time. We were able to cut child hunger in half. Unfortunately, Congress allowed those extensions to expire. The next year, we saw child poverty and child hunger rise as a result of that. And we're going to see hunger increase to the extent that SNAP gets cut. These cuts to Medicaid and SNAP are a really clear example of how economic policy also works as public health policy. When we make decisions like this, we are deciding explicitly who has access to healthcare, who has access to food, who has access to a quality life and who doesn't. And ultimately, we are deciding who will get to live and for how long and in what quality. And so these are also very clearly moral issues that we're talking about, right? We are talking about who lives and who dies. And what this budget bill has essentially done is put forward a new set of priorities for the United States. We care more about relieving the tax burden from the wealthiest Americans than making sure that families and their children have access to healthcare and to food, and that the environment remains safe, and that we track weather patterns and do all of these things that at one point we had decided was important enough to invest in. That's the real loss that comes as a result of this bill passing. What does it mean for Black families? Black folks disproportionately benefit from many of these government programs, which isn't to say that white folks don't also benefit. In fact, the majority of the folks who benefit from SNAP are indeed white. It's just that Black families make up a larger share of recipients from these programs compared to their share of the overall population. People from every group are going to be hurt by this bill passing. The folks who benefit are disproportionately the folks who are at the very top of the income distribution. And of course, corporations are going to see a tax cut as a result of this bill passing. And so yes, again, it's a shifting of priorities for the federal government. And what that's going to mean is that states and cities are going to have to step in to the extent that they can to fill in the gaps that have been left by the federal government here.